One of the questions on the nurse practitioner boards, either skip it, go back to it, or mark it and go back to it, or choose the answer, mark it, go back to it. How long did I study for? Sufficient amount of time to study and you will pass your nurse practitioner or NP boards. You will pass your nurse practitioner boards or NP boards. You know, you want to have the confidence and the mindset that you will pass. You have to manifest it. Hey guys, welcome back to my channel, and today I will be discussing how to pass your NP boards. And yes, you will pass on the first try. So let's get right into it. So first off, I just want to congratulate you. Congratulations for reaching to the point where you are either ready to take your NP boards, or you're preparing to take your NP boards, or if you are ready to embark on your NP journey, so you just kind of want to get a super head start. Either way, congratulations on making it to this point, because obviously you have to be a registered nurse first and decide to go back to school and just have that ambition and drive. So kudos to you. And now it's time to finish off strong, get that boards certification, and start into your field of work. So before we start, I would say that passing your NP boards has a lot to do with your mental, right? So you want to be in the right mental space, and you want to kind of manifest it. You want to receive it, and you want to put it out there in the air that you are going to pass. So I just want to start off with this really quick exercise. So we are going to breathe in positivity and release negativity. So on the count of 3, you're just going to take a deep breath and kind of breathe in all that positivity, that you're going to pass your NP exam on the first try, that you're going to walk into this test with confidence and execute and go in there for what you came in there for. You're going to walk into that testing center and walk out with what you came in there for, and then we are just going to release all the negativity, all the self-doubt, all the self-questioning, all of the fear, because you're going to pass. Like, it's going to happen. You're going to prepare adequately. You're going to pass. You're going to feel like you're not ready, which is normal, but you are going to pass. Okay, so now that we got our mind right, we got the positivity into the air, let's do the work and let's study the correct materials, because I swear there's nothing worse to me than studying the wrong material, or like studying or focusing on information that is not pertinent to the test or pertinent to what you're trying to do. Okay, so first off, so there's 2 types of NP boards you can take. You can either take the ANCC, which is the American Nursing Credentialing Center. That's the test that I took. Or you can take the AANP, which is the American Association of Nurse Practitioners. So I opted to take the ANCC because my professor at the time pushed for us to take that certification, and it has, research-based and ethics and a lot of evidence-based practice and leadership questions on that exam. The AANP is more like clinical based. I mean, the ANCC does have clinical questions, obviously, but apparently, according to my professor, she said that it's a little bit more recognized, the ANCC. And then when you do take the ANCC, you put the -BC board certified. You are a board certified nurse practitioner once you take the ANCC. So I would encourage everyone to take it. So basically I'm just going to encourage everyone to take that one. Obviously it's up to you. If you want me to do a separate video comparing and contrasting the ANCC versus the AANP, I can definitely go ahead and do that for you. How long did I study for? So I studied for a total of 1 month. I studied for about 4 weeks, maybe 4 weeks and a few days. And I was working at the time full-time as a registered nurse on the night shift, so I would basically study on my days off. So as you know, when you work the night shift, you work 3 nights generally a week, and then the first night off that you're off, you're going to use that night to sleep and recuperate. So that's already 4 days out of the week, and then the remaining 3 days I would use full day from morning to night, and I would study, and that was more than enough for me. So if you are working full-time, I would say 4 to 5 weeks should be enough. And then I started studying maybe like 2 weeks after graduation. So I graduated, I took 2 weeks off to kind of just relax, enjoy, and just kind of like relish in my accomplishment. And then after 2 weeks I got right into the studying. So I would say don't wait too long to start studying, and then I would say about a month if you're working full-time is ample amount of time to study and prepare for it. And if you are not working at the time, maybe you can push for maybe 2 to 3 weeks, or 3 to 4 weeks, and that would be studying every day, morning till night, and kind of like putting yourself in prison is what I call it. Just like eat, breathe, and sleep that book and the material in questions. Oh, the study materials. Okay, so I went to Hunter College, Bellevue School of Nursing in New York City, and my school paid for us to have the Margaret Fitzgerald review class for adult geriatric nurse practitioner review. So again, I am an adult geriatric primary care nurse practitioner. I am master prepared, and the book that I used, the study material, was the Margaret Fitzgerald review course for adult geriatric nurse practitioners. Well, the book actually says family and adult geriatric, but we just didn't go over pediatrics and GYN or OBGYN because that was not a part of our curriculum. I am not licensed to take care of maternity patients, OBGYN patients, and I'm not licensed to take care of pediatric patients, just to make that very clear. So my school's paid for this review course that was a 2-day course, which was basically study material. So someone came into the lecture class and they basically went over the core material that we needed to know, medications, diagnosis, questions that are like highly likely, or material that's very likely to be on the exam. So that was a 2-day course. Then that book did have some questions, review questions that we could also review, but my school also paid for Board Vitals, which is a question bank. So the adult geriatric primary care nurse practitioner Board Vitals has a question bank, and basically it goes by system: mental health, cardiac, lung, endocrine, etc. And then I just did all of the questions from that bank, and that's all I studied. So again, for material, the Margaret Fitzgerald review course, it was 2 days that my school paid for, and then my school also paid for the question bank, Board Vitals, and that question bank I did all of the systems. Yes, the Board Vitals questions were harder than the test. So once you kind of do fairly well on the Board Vitals questions, I would say scoring 60 to 70% of the questions correct, then you are more than prepared. And again, 1 month working full-time 3 days a week is more than enough time to pass, and on your first try. And if you are not working, you can push for maybe 2 to 3 weeks. I would say maybe 3 weeks, 2 to 3 weeks, more so on the 3-week side if you're going to be very, very, very ambitious. Okay, so and then I'm going to insert the book. Board Vitals is an online question bank. Okay, so that's what I use to study. Again, I took my test in 2020. We're now in 2023, so I took my test 3 years ago. So just so you can have a time frame of when I studied for the test. I did pass on my first try, and yes, you do find out whether you pass or not right away. You get a email, I believe, right away letting you know whether you pass. So it is 175 questions. 150 of the questions do count towards your actual score, and the other 25 are just kind of like trial questions that they throw in to see if they will consider that question in the future for future exams. So a total of 175 questions. You can go back and change your answers. So if you have a question, if you're on a question and you feel stuck, you can mark it, or pretty much skip it, mark it, and go back to it. So it's not like the NCLEX where you kind of pick a question and it's final. That's what it is. You move on. You can actually go back and check your questions, and you get 3.5 hours to answer your questions, which was just the right amount of time actually for me. I used most of my time on the test because those questions that that have you tripped up, that you're like, you don't know if you want to change your answers, they kind of like had me a little tripped up a little bit. But 3.5 hours, I didn't feel like I needed more time. It was just about enough. I may have had like 20 minutes left over, to be honest with you. So during the test, okay. So some advice that I could give during the test is don't spend too much time on one question, which is kind of like testing 101. Just skip it, move on. Now that you're a nurse practitioner, you do have RN experience. So whenever you really kind of have no clue what the answer is, your common sense and your nursing judgment goes a very, very long way. Sometimes you have to be very realistic. Some of the answers may sound like they make sense. Like when you read them, it may sound like it makes sense. But if you think of it like the patient is right in front of you in your office, it's just not a practical thing to do. And a lot of things kind of delay care, and the patient needs something kind of in the more immediate sense. So, yeah, like I said, your common sense goes a really, really long way. So trust your instinct, trust your nursing judgment whenever you're on a question that you're totally stumped on. And again, don't spend too much time on the question that you're not too sure about. Either skip it, go back to it, or mark it and go back to it. Or choose the answer, mark it, go back to it. If you do plan to take the ANCC test, there's quite a bit of research, ethics, and leadership questions. You know, those are the questions you don't want to get wrong, especially if they're very concrete, objective questions. What is empathy? What is benevolence? There's questions like that. There's a lot of cultural competent questions. So make sure you go over that, and research questions. So controlled, independent variable versus dependent variable, a placebo effect, you know, a sample size. You want to know those core definitions, those concepts, because those are going to be really quick, easy answers that you don't want to get wrong. Okay, that's pretty much it. That's how I pretty much passed my NP boards. Did I feel like I was prepared when I went in for the test? No. But you just got to take it. You just got to schedule it. And if you're going to wait till you're super comfortable, you'll never schedule it. So, you know, just trust that you studied, and trust your RN judgment, and trust, you know, your clinicals, trust the process. And typically if your school has a high passing rate, you should be okay. All right. I don't know what tools that your school may have paid for you or invested in you to pass, but I would utilize those tools. Yeah, but in a nutshell, in order to pass this test, if you're working full-time, 1 month, you know, that one book for actual, Margaret Fitzgerald was excellent for actual study material content. And then it did come with some question bank questions, but Board Vitals was a separate question bank. The questions were way harder than the test. And I exhausted all those questions, and I did totally fine on the test. I also did have a really good professor, and I swear to you, during the test, I heard my professor's voice. Like certain concepts, I'm like, wait, what did she say in lecture? So I lucked out as far as that goes as well. And again, you guys will pass your NP boards, okay? So, you know, it's part your mental, right? You know, your mindset. You know, you want to have the confidence and the mindset that you will pass. You have to manifest it. And then you have to do your work. You have to study the material, and you have to, you know, prepare to some extent, but don't overkill. Okay. Don't wait too long to study, and give yourself a sufficient amount of time to study, and you will pass your nurse practitioner or NP boards. You will pass your nurse practitioner boards or NP boards. Just make sure you prepare, make sure you go in with the confidence, the right mindset, you manifest it, you do the work, and you will get it done. Make sure you schedule your exam. Don't postpone your exam. Just go ahead and do it. And you got this. And congratulations on coming this far. And if anyone If this video has helped anyone, just or when you do pass your NP boards, just leave a comment, let me know. So my next video, I was going to share how I passed my critical care registered nurse exam / certification. I studied for about 2 weeks, so I'm debating whether I should do that video next or if I should do a video for my luxury items lovers. If you guys want me to do more nurse practitioner geared, how I passed the CCRN exam, how to apply to nurse practitioner school, so let me know. Do you guys want more luxury if you guys want more luxury content versus nurse practitioner nursing content, just let me know. But I'm trying to kind of balance it out, like one, like one video nursing, the other video luxury, nursing, luxury. I'm trying to keep a nice even balance. But like I said, good luck again on passing your nurse practitioner boards. Take it, schedule it, take it, it's yours. Go into that testing center and snatch that certification, snatch it from them. Okay, we're going in there and we're not leaving without the PASS, because we're gonna pass. So again, thank you guys for watching, and stay tuned for my next video. Like, comment, and subscribe. If you know anyone that wants to be a nurse, they're considering nursing, if they're preparing for their boards, their nurse practitioner boards, just refer them to my channel, and hopefully they can take home, words of encouragement or information that would help them take them to the next level and pass their tests. So like, comment, and subscribe. Alright guys, thanks for watching.